first, there's different kinds of lower expanders. You can have one that is removable, you take in and out. There's even different companies out there that are trying to use mouth guards, essentially mouth guards, to expand, push the teeth out at different ages, and there's some questionability there. Anyways, that's for another video. One that you can take in and out, called the Schwartz appliance. And then there is a fixed option that does the same thing. It's glued in, kind of like the traditional top glued in appliance, right? There's usually a removable appliance and there's a fixed appliance for that same appliance. A lot of appliances. Okay. Basically, if you check out our other videos regarding top expanders, right? There's some similarities. You'll notice some similarities. It's not that different, right? We've got those metal rings in the back. That's what holds on to our anchor teeth. And then we've got these other metal wires that are coming off a main wire. Those are rests. They help stabilize the expander when you push it down, resting on the teeth. And then you've got the screw right in the middle. That's what you use a key to turn, and it slowly pushes the bar out. Ooh, you can even see, look, there's the arrow. It's gonna point back to the back of the throat. That's the direction you turn. And you can even see those little holes in the expander. The screw is cylindrical and it has 3 holes, and you put it in one, the key in one, you turn it, and the next hole pops up, right? It rotates like this, and the new hole appears every time you turn it. And slowly it gets wider and wider and wider because the teeth are moving out and the screw is getting bigger. There's the key. It's got a little bend at the end, and that's about as far as it goes into the hole. It doesn't go past that bend if you're trying to figure out how to get it down in. Push it that direction. So for this type of expander, those metal rings, they go all the way in between the teeth. So, yep, you got it. Have to have separators first. Pop those little blue things out. Usually they're in for a couple days to a week. You don't want to leave them in there, just like rubber bands that go around your teeth. People that are trying to close their spaces with rubber bands, right? Those rubber bands can disappear up in your gums. The same thing can happen with the separators if you leave them in there too long. Don't want that. There it is, there it is. You can see the spaces on both sides of those baby molars. That's what the separators do. Over a period of a few days to a week, it pushes the teeth apart and you have space so that those skinny little metal rings can fit down in between the teeth. Most appliances, if you're trying to glue into the mouth, orthodontic appliances, you want to have dry teeth. So when we're ready, first we try it in, then when we're ready, we dry everything off, we put the glue in the rings, and then we slam it into place. We don't really slam it, don't worry. Don't worry, we're not talking about, you know, Stone Cold Steve Austin. We're just talking about gently pushing it into your mouth. Okay, so we got those little cotton rolls. It's one way to keep the teeth dry, blow a lot of air. It's hard to keep them in place. The tongue is just all over the place. Got some on the inside and the outside. Here's the blue glue. That's in the way. Take the appliance back out. We'll just take the cotton rolls out. We're trying to sneak it around the cotton rolls, but it's hard. Push it down with finger pressure and wipe off the glue. Same thing on the other side. And then we're gonna tuck it in a little bit more with the bite stick. The handy dandy bite stick. And bite. Remember, don't just bite like crazy. Bite when you're asked to bite. Focus. You need to turn off the TV or close your eyes for a second, just listen. Bite when you're supposed to try and help the efficiency of the process. There shouldn't be a lot of pinching or poking or anything like that. It should just go into place. Then once you've got it in, the orthodontist is happy about its position. Then you can use the light. And the light. For those of you who are thinking about or who have plans to get a lower expander that might be glued in, now you know what it's gonna be like. Hopefully that helps. If you know a friend that is preparing for a lower expander or even a top expander, remember there's some similarities, you could show them this video. Or if you have friends that are considering orthodontic treatment, the benefits or the needs of orthodontic treatment for your young child, or your older self, feel free to stop in. You can schedule a consult online or call our office. We are in McKinney and and Anna. And of course, in the meantime, consider subscribing to the channel so that I can open your eyes to the wonderful world of straight teeth, sometimes expanders, and beautiful bites. That's all I've got, just a little PFO and so you know where you're going. Packard out.